In this section, we're going to look at urine analysis. It is a very common lab that is obtained on people. So you simply pee in a cup and it's sent to the lab, and they have various chemistries on how to assess for that, the chemistry within a urine, so the physical and chemical properties of urine. Can also be obtained from if someone is catheterized. All right, here is an example of a chem strip, a chemistry strip that you can use. So essentially, the person or the patient is going to uh, pee in a cup. Okay, so, and then you'll take this dipstick and you dip it in to get all of these little squares on the strip saturated with urine, and you let it sit for about a minute. Okay, it takes about a minute to acclimate, and then you put the chem strip up against the colors on your bottle there, and then that will give you your reading. Okay, so it's pretty easy. You just match the color with the color on your legend there. Now, in this case, what they're saying is okay is the glucose, the pH, ketones, bilirubin, blood, hemoglobin, and protein. But what came back positive was urine-specific gravity, white blood cells, urobilinogen, and nitrites. Okay, so to interpret this, the urine-specific gravity, this is looks for dehydration. And the weight of distilled water is 1.000. So it doesn't get any better than distilled water. So the best urine can get is 1.001. And so the bigger this number, so for example, 1.040 would start to indicate dehydration. Okay, so that's the specific gravity. So another way of looking at that is if you have fluid with a lot of content in there, it's going to be heavier, right? So the specific gravity. And if it's very diluted, because there's a lot of fluid, then the specific gravity will be better. Okay, white blood cells indicates an infection. And urobilinogen ultimately looks at liver function and possibly gut function. It's a byproduct of bilirubin metabolism, which is a liver and gut function. So if you see it in the urine, then the next thing you would likely want to assess is liver. Nitrites that are found in urine, that's a chemical compound that is from meats. Okay, so such as like a ribeye steak and things like that. However, if your body is not processing the protein, a byproduct is nitrites, and it can spill into the urine. So that could be a diet issue, could be a liver, a digestive dysfunction. Also, it might indicate urinary tract infection. Okay, so a urine analysis is really good to assess a person's overall health. Okay, here's an example of a lab result, and this is actually from LabCorp. So we have specific gravity. And what's nice about a lot of the labs today is they will make the abnormals or out of range stand out. Okay, in the old days, before they had this kind of computer software, you just had to know the numbers, but today they let you know. Okay, pH. For urine, optimal is 6.5 to 7.5. So we're good here. And here's a little trick that you should know for pH, and that is if the urine sits longer for 5 minutes, the pH starts to change. So it's best to test the urine within 5 minutes. Okay, the color of urine, it should be in the yellow family. So in this case, we're looking at cloudy, which can indicate an infection, and white blood cells is positive, so likely dealing with an infection here. However, no proteins, no glucose, no ketones, no occult blood, no bilirubin or urobilinogen. The nitrates are fine. Okay, a microscope exam. We'll talk about that in a second. Found white blood cells, no red blood cells, and or casts, which we'll talk about that in a second. Okay, so this person is dealing with some sort of an infection. Okay, it could be a urinary tract infection, a bladder infection, or a kidney infection. All right, these are some of the things that they will look under a microscope. So they'll take some of the urine, and put it on a slide and look at it under a microscope. And you are looking for these casts, which essentially is like human tissue. Okay, there's more casts. You can find sperm, hyaline cast, waxy cast. So you see this word cast a lot. It's just looking for that's human tissue that's starting to spill into the urine. Okay, there can be crystals. Okay, this can be in the, this is the most common form of so-called kidney stones, which comes from calcium oxalate. Okay, it can also be uric acid crystals, so that's going to be in the gout family. And so these are some of the things that they look for in a urine analysis, microscope exam part. Okay, other things would be odor. So urine does have a certain kind of smell to it. And if it is sweet or fruity, could be dealing with diabetes. There's a really foul smell that if there's a bacterial infection. All right, here's a bunch of other properties that you can find in urine. So your physical properties, inorganic, such as chlorine, sodium, potassium, phosphates, ammonia, calcium, magnesium. Your nitrogenous wastes, urea, creatinine, uric acid, urobilinogen, bilirubin, and other organics, so amino acids, ketones, carbohydrates, and lipids. Okay, now ketones, this is one that I monitor quite often in my clinic because of people that are on a ketone diet. You don't want to be too deep into ketosis. And if you're on a ketone diet, you want to make sure that you're actually in ketosis. So a urine can help assess that. You can also do a blood ketone. So you prick the finger, put it on the meter, and lets us know if you're in ketosis or not. Okay, also diabetics are at risk for being in what's called ketoacidosis, which is very dangerous. They're too acidic. So a urine analysis will be helpful to assess that. All right, GFR, so the glomerular filtration rate, is a very valuable test to assess the health of the kidneys. So you want to be 120 milliliters per minute, and a renal failure score is going to be 15 or less. Okay, and at that point, that person is going to be on dialysis. Okay, that would actually be stage 5 kidney disease. All right, the ureters go from the kidney to the urinary bladder. It does have transitional epithelial tissue in it, which means it's able to recess into itself to make the tube diameter bigger. And it does have smooth muscles, so it can help with a peristaltic wave, allow the urine to flow down into the urinary bladder. Okay, the urinary bladder is a temporary storage for the urine, and so there's an area in here called the trigone. So tri is 3, so it does have those 3 sides. And the boundaries are the urethral openings. And you can see right here this tube that comes in. So the ureter that comes in, it embeds itself into this area of the urinary bladder. So it creates a hole. And this is where the fluid, the urine, will leak into. Okay, and so that's the boundaries that creates what's called the trigone area. Okay, so on this side, so this is a male, and this is a female, and it has to do with, or one thing in males is the prostate. Okay, so the urethra, which essentially is the pee tube, as urine is spilled and eventually goes to the external environment through the urethra, it does have to pass through the prostate. So they call that part the prostatic urethra. And as men get older, a risk is an enlarged prostate, which can push in on this prostatic urethra part to make it difficult to begin to pee. Okay, we also have a urogenital diaphragm, an external urethral sphincter, and an internal urethral sphincter. So you have conscious control of the external urethral sphincter. So if you want to hold your pee, you'll contract that particular sphincter. However, the internal one is autonomic, so that one will relax on purpose. Once enough urine has filled the urinary bladder, you get a stretch reflex, which is right here. So the urinary bladder is also transitional epithelium, which means it has the ability to, the cells recess into themselves, increasing volume. And when there's enough of a stretch reflex, it does send a signal up to the brain. Okay, now these nerves come in and out of the sacrum area and travels up the pons, is ultimately responsible for that, so it's part of the brainstem. And it's also a very strong parasympathetic neurological stimulation. Now remember, parasympathetic is rest and digest. So your bowel and bladder function does best in parasympathetics. Okay, the female urinary bladder, it has a shorter urethra, and so those in a medical setting that do catheterizations, there is obviously a different feel between a putting in a catheter into a female versus a catheter into a male. Okay, so of course, in that learning process, they're taught, and there's actually a certain feel from the length of the urethra. All right, some fancy words for urinating is voiding or urinating or micturition. Okay, that's the ability to relieve yourself, so go to the bathroom. All right, that stretch receptor of the bladder ascends the spinal cord and goes to a nucleus in the pons called the micturition center. And this nucleus integrates information about the bladder tension and information from the brain centers such as the amygdala and the cerebrum. So this is where we get that urge to go to the bathroom. So it is a very strong neurological phenomenon.